seen some patients whereby all they want to do is to kill themselves. And why do I say something like this? You have a patient that you are running fluids, you are giving fluids, and all they are thinking about is to rush that fluid. You don't know there's a reason why that thing is set at that rate, but you carry your hands, try to rush so it can go on very, very quick. There is a danger to that thing you're doing. Like there's a big danger to that thing you're doing, and if you're not careful enough, you will kill yourself. In this video, I'm talking about some fluids and why you should not rush them. Because if you rush them, it has consequences. The first one is potassium chloride. This fluid, if it is rushed, it can affect the cardiac activities of the heart, and it is very, very delicate. Normally, this fluid is given very, very, very slow. If you rush it, you will die. And one of the things that you likely see is that person will have cardiac arrhythmia. Person can just suddenly have cardiac attack from nowhere if that fluid is rushed. The third one is that the person can just suddenly just die, slump and die. So do not rush potassium chloride for anything. And this advice is majorly for those patients that like doing these things. It's not important. There's a reason why the doctors and nurses has done it like that, so that it will be effective, not for you to draw it how you want, so I can run on. The second fluid you should not rush is what? An hypertonic saline. An example is the 3% normal saline. And why you should not do this is because it can affect the brain cells. So if the brain cells are affected, it can result to certain conditions like what? Seizure immediately. Secondly, the person can just have brain damage, whereby the brain that cannot easily function anymore, and then results towards non-functional state of what remain part of the body. So that must also be run slowly. Patience, be careful. The fluid must not rush is mannitol, and mannitol is an osmotic diuretic. That means it helps to reduce brain swelling. So if you rush this fluid, one thing that you likely see in that patient will have hypotension. There will be hypotension, and there will be pulmonary edema. So this pulmonary edema is whereby there is excessive fluid in the lungs. So I know you don't want this kind of things to happen to you, and that's why I'm trying to tell you these things so that you will not go to hospital and be rushing fluid that they give to you.